Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. But I always like to get into my disclaimer and reminder that we know there's no absolute in medicine. We treat on a patient by patient basis, and any of the questions that I have here are designed based on the guidelines that are currently being tested on the AANP as well as ANCC exam. Now, any of my videos where I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get started with our questions for today. Question number one states a mother brings her 3-year-old son into the office with complaints of a rash to his face. Upon examination, honey cluster areas are noted around the 3-year-old's mouth and cheek. Based on this presentation, what is the best diagnosis? Is it A, roseola, B, hand, foot, mouth disease, C, impetigo, or D, rubella? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because this allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states based on this presentation, what is the best diagnosis? You know what I always say if we are looking for a diagnosis, we need to run it back and see what the assessment findings are. How are they presenting? What are those subjective things that they're complaining of, and what are the objective? What are we observing on assessment and exam as the providers, right? So here, a mother brings in her 3-year-old son. She's complaining of a rash to his face. Upon examination, the nurse practitioner notes honey cluster areas around the 3-year-old's mouth and cheek. You know my things. This is one of those key identifiers. When I say this, you say that. So when I say honey clustered areas or honey covered areas, you should say impetigo, right? So your best answer here is C, impetigo. Question number two, the nurse practitioner's diagnosis. The nurse practitioner diagnoses the 3-year-old with a mild case of impetigo. What is the best treatment option at this time? Is it A, methotrexate, B, 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 mupirocin, C, doxycycline, or D, moxicillin? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, what is the best treatment option at this time? All right, so what are we treating? If they're asking for a treatment, you need to run it back and see what the diagnosis is. Have they provided a diagnosis? Do you know what the diagnosis is? And if you do not, you need to run it back a step further and figure out based off of the assessment findings, right? But here they state that the nurse practitioner has diagnosed the 3-year-old with a mild case of impetigo. So how do we treat impetigo? Is it A, methotrexate? No. Would it be B, mupirocin? Yes, mupirocin ointment is the best answer choice here. It is a topical ointment, and typically in mild cases of impetigo, that is our first line therapy that we utilize. Okay. And question number three. The mother returns with her 3-year-old son after applying the mupirocin as prescribed without any improvement. What is the next best step by the nurse practitioner? Is it A, prescribe Augmentin or Keflex, B, prescribe doxycycline, C, prescribe methotrexate and doxycycline, or D, prescribe methotrexate or Keflex? Take a moment and tell me what you got in the comments, you guys. All right, so STEM of the question states, what is the next best step by the nurse practitioner? All right, so STEM right here is asking you what is the next thing you should do and what is the best thing you should do, okay? So that means that there's common things that we can do. There's different scenarios, but what is the next thing we should do and what is the best one out of that option, right? So what's going on here? The mother has returned with our 3-year-old. This 3-year-old came in with these honey cluster rash. As a nurse practitioner, we have diagnosed the patient with mild impetigo. We started with treatment of the mupirocin ointment, And now mom is back with her 3-year-old son saying that there hasn't been any improvement. So what are we doing now? Is it A, prescribe Augmentin or Keflex? And yes, that is the best answer. Once you try that topical option and there's still no improvement and they're back in your office, you want to go with an oral antibiotic to help to get some resolution and treat this issue. Augmentin and Keflex are two of those first line options that you can use for oral antibiotic. So again, A, prescribe Augmentin or Keflex. As always, you guys, I hope you found this helpful. I've been trying to do this a little bit this way too, because I always teach and recommend studying and assessment, diagnosis, evaluation, and treatment. But I've been trying to just pinpoint certain diagnoses and walking you through so that you're able to identify the assessment and identify the diagnosis, identify the differentials and the diagnostic exams, how to evaluate, how to treat, and looking at first line and the next line in the event that it doesn't happen. So you can start to gear your mind to study in that plan, because again, I guarantee you guys are like, oh, I know impetigo, honey cluster, up, mupirocin, and then you stop. You don't know next. So if they tell you, hey, the mupirocin didn't work, what do you do next? You're stuck. And in your mind, you know impetigo, but you don't know it all the way around. So I'm big on strengthening your muscle memory from all angles so that however they may present or come to you with questions that you're able to navigate and answer and pivot whichever direction they take you. Okay. All right, you guys, again, as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I offer, my review book, ebook, and paperback option are both linked in the bio of this channel. My self-paced review course that is designed for family and adult Gero for the AAMP and AMCC exam is also linked in the bio of this channel. 5-week review course starts next week. We are full for that class. And then the one-on-one sessions, I always say either give us a call or shoot us an email so we can gauge what you really need, because it is customized to where you are. If it's for weaknesses, to make it a strength. If it's for your exam readiness assessment, or if you need a custom plan saying like, hey, I've been unsuccessful before and I'm looking for some structure and design to get me back on track and for you to study along with me to help me go to a successful score. That's also a one-on-one option. So just give us a call at 803-400-6864. You can also shoot a text to that number or shoot us an email at thenursestudio1 at gmail.com. But make sure you meet me back here. Happy studying. Bye, y'all.